As we all know, coronavirus has become a global emergency. Let's take a look at the past 12 deadly viruses leading up to coronavirus and how coronavirus got its name. Before we get started, please don't forget to like, subscribe, and click on the push notifications to get instant updates whenever I post new videos. So, let's get started. Number 12. Marburg virus. This is similar to Ebola, where it causes high fevers and internal bleeding throughout the body. The mortality rate was 25% during its first outbreak in Germany in the year 1967. However, in the second outbreak, the mortality rate jumped to 80%. The origin was in Germany, where infected monkeys from Uganda spread it to anyone who came close to them. Then, the second outbreak was in Angola and Congo from 1998 to 2000. The incubation period for anyone who was close to infected people or animals was 2 to 21 days. As of yet, there is no proven treatment available for Marburg virus disease. However, a range of potential treatments, including blood products, immune therapies, and drug therapies, are currently being evaluated. Number 11. Ebola. The first outbreak was in 1976 in Congo, in a community near Ebola River. There were 318 cases, with 218 deaths. That's 80% mortality rate. It started from fruit bats being infected and spreading it to humans who consumed it. The outbreak happened again in 2014 to 2016 in Western Africa and is the largest and most complex outbreak of the disease to date. There is no proven treatment for Ebola, but simple interventions in the early stages can significantly improve the chances of survival. Hand hygiene is the most effective way to prevent the spread of Ebola virus. An experimental Ebola vaccine proved highly effective against the deadly virus, which was discovered in 2015 to treat patients. Number 10. Rabies. Rabies can affect both domestic and wild animals. It is spread to people through bites or scratches, usually via saliva. First cases were discovered in early 1920s and mostly occurred in Asia and African regions. Human rabies vaccines were developed and are available, but people in developing countries who cannot afford it cannot be saved. If rabies is not treated, it has a 100% death rate. There have been preventative measures taken by vaccinating dogs with the rabies vaccinations. This has helped significantly reduce the number of cases of rabies. Number 9. HIV. The disease first was recognized in 1980s. HIV destroys white cells called CD4 by weakening a person's immunity against infections such as tuberculosis or some cancers. According to the World Health Organization, there were 37.9 million people living with HIV in the world. At the end of 2018, 62% of all people living with HIV had access to antiretroviral therapy at the end of 2018. 8.1 million people living with HIV did not know they had HIV. Number 8. Smallpox. This has plagued humans for thousands of years. In 1980, the World Health Assembly declared the world free of smallpox. Smallpox is thought to have originated in India or Egypt at least 3,000 years ago. The earliest evidence of the disease comes from the Egyptian pharaoh Ramses V, who died in 1157 BC. His mummified remains show telltale pockmarks on his skin. Incubation period was from 7 to 19 days. You start with an early rash, which turns into scabs, and then fall off. Once you've developed the smallpox rash, the vaccine will not protect you. Number 7. Hantavirus, also known as HPS, started out in 1993. Initially started by infected deer mice spreading it to humans through any activity that puts you in contact with the rodent droppings, urine, saliva, or nesting materials. 4 to 10 days after the initial phase of high fever, the late symptoms of HPS appear. This includes coughing, shortness of breath. There are no specific treatments, cures, or vaccinations for hantavirus infection. However, we do know that if infected individuals are recognized early and receive medical care in an intensive care unit, they may do better. In the intensive care, patients are incubated and given oxygen therapy to help them through the period of severe respiratory distress. Preventative measures should be to eliminate or minimize contact with rodents in your home, workplace, or campsites. Number 6. Influenza. The first deadly flu was the Spanish flu, which started in 1918. It sickened up to 40% of the world's population, killing an estimated 50 million people. Then came the H1N1 virus that emerged in 2009. The mortality rate was 0.03% of the world's population. On August 10, 2010, World Health Organization marked the end of H1N1 virus. People with flu can spread it to others up to 6 feet away. The influenza A and B viruses that routinely spread in people are responsible for seasonal flu epidemics each year. The best way to prevent flu is getting vaccinated each year. Number 5. Dengue. First appearance of the dengue fever was in Philippines and Thailand in 1950s. This is a mosquito-borne viral disease from female mosquitoes. Dengue should be suspected when a high fever is accompanied by severe headache, pain behind the eyes, muscle pains and joint pains, nausea, vomiting, swollen glands, and rash. There are approved vaccinations available currently. However, recipients must have contracted a confirmed case of dengue in the past. Those who have not caught the virus before could be put at risk of developing severe dengue if given the vaccine. Number 4. Rotavirus. This is a severe diarrhea disease in young children throughout the world. In 2013, 215,000 children in developing countries died of this illness. Vaccinations are available to prevent severe gastrointestinal diseases. Number 3. SARS Coronavirus. The first outbreak was in 2012 in Saudi Arabia, and then the second outbreak was in 2015 in South Korea. Person-to-person transmission has occurred only with close contact, usually in hospital settings. The disease started from infected camels before passing on to humans and triggers fevers, coughs, and shortness of breath in infected people. As with the SARS coronavirus and the SARS coronavirus 2, which is the COVID-19, MERS has no approved treatments or vaccinations. Since September 2012, World Health Organization has been notified of 2,494 lab-confirmed cases of the infection with MERS coronavirus. 858 MERS coronavirus-associated deaths have occurred since September 2012. 27 countries have reported cases of MERS coronavirus. Number 2. SARS coronavirus. Started in 2013, spreading from animals. As to this day, it's unknown which animal started this virus, but is mostly associated to bats. The virus started in Guangdong, China, in 2002. SARS outbreak in 2003 affected 26 countries with more than 8,000 cases. Most cases of human-to-human transition occurred in the healthcare setting in absence of adequate infection control precautions. Dry cough and flu-like symptoms led to respiratory issues causing the SARS Coronavirus. The end of the global epidemic was in July 2003. SARS has reappeared 4 times since then, including lab accidents in Taipei and Singapore. Number 1. COVID-19 SARS Coronavirus 2 originally started in Wuhan, China in December 2019. The virus is thought to spread mainly from person to person. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. It may be possible that a person can get COVID-19 by touching a surface or object that has virus on it and then touching their own mouth, nose, or possibly their eyes. But this has not thought to be the main way the virus spreads either. After 2 to 14 days of exposure, the symptoms will be cough, shortness of breath, and high fever. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to the virus. To date, antibiotics do not work against viruses. They only work on bacterial infections. COVID-19 is caused by a virus, so antibiotics will not work. To date, there is no vaccine available for specific antiviral medication to prevent or treat COVID-19. The virus that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome, SARS, in 2003 are related to each other genetically. But the diseases they cause are quite different. SARS was more deadly but less infectious than COVID-19. There have been no outbreaks of SARS anywhere in the world since globally there are currently 98,192 confirmed cases. Out of that, 80,711 confirmed cases are from China, with 3,045 deaths. Outside China, the confirmed cases have been 17,481 with 335 deaths. Please make sure to wash your hands and work from home if you have any kind of sickness, and please take care of yourself. Wishing you all a happy and healthy life. Thank you for watching this video. Please don't forget to like and subscribe, and also click on the push notifications to get instant updates on the future videos.